Hi, everyone. I'm joined today by Dr. Kris Olson, who's the director of the MGH Springboard Studio and also the director of the Consortium for Affordable Medical Technologies. And Kris has been working with the Frigoletto Committee to advance some of the wellness work that has been supported by the PO. So, Kris, thank you for joining me today in the two things. And first, I'd like to ask if you could share with our faculty what is the WeSolve Stupid Stuff campaign and also the Springboard Studio.
Great. So thank you for having me, Marcela. The WeSolve Stupid Stuff campaign is really something that arose with the work with the Frigoletto Committee, where we recognize that there are so many frustrating aspects of our care that gets in the way of delivering really fantastic patient care. And so we launched this program really when we were all able to get together in person at the pop-up lounges that the MGPO was holding, and we just allowed people to start writing on Post-its and putting them on the wall. And now we realize that that was an overwhelming success, and a lot of people wanted to really vent the things that were frustrating them. But we also realized that it was a fantastic platform for people coming together and realizing that they also had those same challenges. And so now what we're talking about is really allowing more people access to this by having it on an online platform.
That's great, Kris. And I know that the experience began in the pop-up faculty resource rooms, but can you tell us a little bit about how many and what kind of challenges were submitted?
Yeah, it was really fantastic because it was just in 3 of those lounges. We put out felt pens and Post-it notes and asked people to say these challenges that they felt. And we had 450 challenges put up on those walls. And when you started collating them, there was about 90 unique challenges, and they ranged from everything that you might expect. Things related to Epic or IT, but also things that were in the built environment, something that wasn't working, a leaky pipe. Somebody even mentioned that one of their biggest frustrations was how they walked into a bathroom and had a really small garbage can beneath the hole, so it was always overflowing. And it was something that was such an easy fix.
That's great, Kris. And obviously with the current restrictions around getting together physically and physical distancing mandates, obviously the pop-up faculty resource rooms have been on hold. And you spoke a little bit earlier about this new option to submit some of these challenges online. Can you talk to us a little bit about that platform and how physicians and other clinicians can engage in that?
Yeah, what we really are going to encourage is that all of us, in the course of our day, when you're recognizing something that is giving an undue hindrance or frustration to your daily work, please submit it on the WeSolve Stupid Stuff online platform. And more so, even if you don't have a specific idea, please go on and look at those, and there's going to be an option to upvote the different challenges, and so sort of giving a thumbs up to one is agreeing that is a frustration, and it'll help us prioritize those challenges.
That's great, Kris. And then for our clinicians to know that you can actually access the online platform either through the link that we send in the MGPO bulletin or also by going to the MGPO website on the internet. And then, Kris, can you speak to us a little bit about how are you going to use that information? How are you going to use all that repository of challenges that you're collecting? What's next?
Yeah, and I think that's one of the biggest things, right? What we don't want this to be is a suggestion box on top of a garbage can. And so one of the big things that is happening now is really getting a cadre of people around the hospital that will receive these challenges when they're relevant to their realm, whether it's buildings and grounds, whether it's the Epic team, IT. But then the other important thing is those challenges that need some inputs to them, some creative thoughts around how to solve them. We're going to be looking at the ones that seem to impact a number of people, that seem to be within the realm of of something that we collectively can fix, and bringing them into collective problem-solving events in 2021. And so this is really not designed as a platform where you're just putting off your challenge and it's magically solved. It's really taking advantage of these, the fantastic and creative side of our community, and trying to use that community to solve these challenges in the most effective way.
Great, and I certainly have heard from some of the physicians who participated in the Springboard studios that there was a real element of, with the physical connection of just getting around the table with other colleagues and just spending the time and understanding and realizing that some of these challenges are not unique to your practice or to your or that you're facing alone, but there's a real sense of, I would say, community, and also, I think, empowerment in being able to be part of the solution to these challenges. So, Kris, I thank you again for your time today, and also for all of your leadership and efforts in guiding this work, and I look forward to some of the solutions that will come out of this, this work. Thank you.
Oh, thank you.